Someone who is not treating you opens your medical record, not to care for you, not to bill you, just to look. Ask most people whether that is a crime, and they will say it depends what happens next, whether it leaks, whether it costs you something. Federal law can reach it anyway. If the access is knowing and unauthorized, no leak is required. And in 2025, an emergency medicine resident in Iowa was sentenced to jail in a case built on exactly that kind of access. Health tech frontier. According to the Justice Department, the man at the center of this case was licensed as a resident physician by the state of Iowa in June 2020 and began an emergency medicine residency that same month. Between 2020 and 2023, he worked in emergency departments at hospitals in Cedar Rapids and Iowa City. Prosecutors say he used the access he had as a resident doctor to a hospital's electronic medical records system. This case does not start with a stolen password. It starts with a clinician using a system he was entitled to use. Prosecutors say that in October 2020, at the Iowa City Hospital, he obtained the medical records of a woman the Justice Department identifies only as MC. In March 2021, at that same hospital, he obtained the records of a woman identified as KF. Then in January 2022, he accessed KF's records again, this time at the Cedar Rapids Hospital, while working a shift in its emergency department. The release is specific about her. KF was never his patient. She was not a patient in that emergency department at the time. She did not know, and she had not consented. Here is where most people's intuition is wrong. The federal criminal statute makes it an offense to knowingly, and in violation of the federal health information rules, obtain someone's individually identifiable health information. Read that again. Obtain, not leak it, not sell it. The statute does not require that anyone be harmed, and it does not require that the information go anywhere at all. No leak required. The obtaining is the offense. And Congress wrote one more sentence. A person, the statute says it in parentheses, including an employee or other individual, is considered to have obtained that information in violation of the law if it is maintained by a covered entity and they obtained it without authorization. That parenthesis is doing an enormous amount of work. It means holding a legitimate login is not, by itself, a defense. Authorization is the pivot alongside the statute's other elements. And authorization to use a system is not the same thing as authorization to open a particular record. What the law does care about is why. The maximum prison term scales in 3 steps. Obtaining it, up to 1 year. Under false pretenses, up to 5. Intending to sell, transfer, or use it for commercial advantage, personal gain, or malicious harm, up to 10. He pled guilty to the middle one. The releases do not spell out what the pretense was, so neither will we. What they do say, separately, is that after KF discovered the access, he asked her to tell the hospital falsely that she had given him permission to look. He was not stopped in the moment. According to the Justice Department, the Iowa City Hospital received an anonymous complaint about him, and it was after that complaint that the hospital discovered he had illegally accessed both women's records. The release does not say how it found them, and we are not going to guess. What we can say is what the law asks of the system. The security rule requires covered entities to put in place mechanisms that record and examine activity in systems containing electronic protected health information. That is a standard. Mandatory, with no addressable exception. None of this rests on the patient alone. The privacy rule puts a standing set of obligations on the hospital itself. A covered entity must designate a privacy official responsible for its policies and a contact person or office to receive complaints. It must train all members of its workforce on its health information policies as necessary and appropriate for them to carry out their functions. It must have appropriate administrative, technical, and physical safeguards. It must provide a process for individuals to complain. When a workforce member fails to comply, the entity must have, and apply, appropriate sanctions, though the rule carves out narrow exceptions for whistleblowers and crime victims. and it must mitigate, to the extent practicable, any harmful effect it knows about from a use or disclosure that broke its own policies or the privacy rules requirements. None of those are suggestions. They are standards, and standards are mandatory. The releases say nothing about whether these hospitals met them, and this episode is not making that judgment. The Justice Department's account is broader than the record access alone. Prosecutors say that in January 2022, he photographed a patient in a hospital gown and sent that photograph to another person through a messaging app, with no legitimate medical purpose for taking it or for sending it. They say that in June 2023, he wrote to the Iowa Board of Medicine acknowledging what he had done, and that part of the explanation in that letter was false. We are not going to describe what the photograph showed. It adds nothing you need, and the patient in it did not choose to be part of any of this. He pled guilty in June 2024 to one count of wrongfully obtaining individually identifiable health information under false pretenses. In January 2025, he was sentenced to 1 month in prison, a fine of $1,000, and 3 years of supervised release. He faced up to 5, and one prosecution proves nothing about doctors or nurses or hospital staff generally. It is one case, and it should be read as one case. The rule does not come from this prosecution. The rule comes from the statute. What this case shows is that statute being enforced. So, can a doctor look up your medical records? Not whenever they like. And the line is not simply whether you are their patient. What matters is whether that particular access is authorized. Being your doctor is not a blanket license to open your chart. If you think someone opened yours, raise it with the provider. The privacy rule requires a contact person or office for complaints and a process. But be clear what that gets you. The audit control requirement obliges the institution to be able to examine its own systems. It is not a right to be handed the log. You can also file with the Office for Civil Rights, and you need not try the provider first. That complaint is about whether a covered entity is complying. It is not how you report an individual's crime. It must be in writing. Name who and what, and be filed within 180 days of when you knew or should have known. Other routes exist too. Licensing boards, state law. This case involved the Iowa Board of Medicine. Most people never ask. This has been Health Tech Frontier. Subscribe for the next chapter.